We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
So I'm going to make a quick presentation about the human cost of inaction. It's based on paper and information. I've had the pleasure of working with my colleague, Dr. Celeste Montfortin, on some of this, and we've been using it to help us write op-eds and other things. So I'm going to give you just a snapshot overview, and at the end you're going to want to know what can you do, and we're going to give you opportunities to make change happen there. So I want to dedicate this to 3 individuals, to Michael, to Janelle, and to Debbie, whose deadly hugs claimed their lives. And as Irving Selikoff said, statistics are people with the tears wiped away. Asbestos victim. We use this word when I testify in front of Congress, and I've testified with Mr. Nolan over here before, and it's anyone who's been exposed to asbestos, diagnosed, died from, and their families left behind is what we use the word victim, and that is my late husband and Emily's father. I want to talk about the human cost of inaction in 4 points that everyone can understand. I want to look at the human, the financial, the environmental, and of course the weak policy decisions that have condoned asbestos use. So if you have 107,000 people dying every year around the world, how on earth can that happen? What is the human cost of inaction of that? That is a stat from the World Health Organization. During the last 115 years, we in the United States have consumed over 31 million metric tons of asbestos. Where is that? You're going to hear more from my dear friend Pat Morrison. It's in buildings, it's in schools, it's in cars. This has plagued America greatly, and you can see the old flyer about the World Trade Center, when your life depends on it, use asbestos. But what about the crumbling towers that fell? When my dear friend Ellen and I went to the World Trade Center, it's shattering. You can only imagine Marilyn describing the plume of dust. As we look at this, the EPA did a study back in the 1980s, and they're talking about buildings and surveying and how many buildings have actually been impacted by asbestos. Estimated that 20% of the 3.6 million facilities studied nationwide contained friable. This is a 30-year-old study. Where are we today? ADAO is working with members of Congress to get those questions answered. In fact, Senators Markey and Boxer, and we've been part of it, have asked governors to tell us where it is in their schools. This is staggering to me because I love firefighters. I mean, Pat Morrison and others, and Celeste is laughing because it's true. They were there for Alan. They were there for our family when Alan was sick. They do more than fight fires. They're there to keep families alive and safe and pulled together. And what happens when NIOSH does a study of 3 cohorts and finds that firefighters have a rate of mesothelioma 2 times greater than the average U.S. population? What does that mean? How does that happen? How many buildings around you are contaminated with asbestos? And do you know where they are? So in a 10-year period, this is NIOSH data. I'm going to read the number because you need to hear it, every single name. I'm not going to round off. 43,464. 43,464. And Alan and Joe and many others are part of this statistic. And this is just deaths of 2 diseases, mesothelioma and asbestosis. And I know Tony and the colleagues over there have buried many of their workmates and others. This is a U.S. statistic over a 10-year period of 2 diseases only. So ADAO has been doing this for 11 years. We know that while promising research continues, the only ways to end mesothelioma and other asbestos-caused disease is prevention or a cure. We have great doctors that are going to talk to you about research, but we know, and all of those doctors would agree, that prevention is imperative, it's critical, it's of utmost importance. So knowledge is power. Knowledge is power. You'll see a sign over here, Hear Asbestos, Think Prevention. We launched that earlier this year. We want people to know when they hear asbestos in the workplace, in the community, have a question, think prevention. Don't wonder anymore. Don't assume. So we use these 3 prongs in our work. The penny slide under Lincoln's nose, you can see 20,000 asbestos fibers, an old resolution there. And of course, it's our storytelling. It's our storytelling. Ellen Patton has been sharing her story with members of Congress for 11 years with us. Every story needs to be heard. Every story. So Sue Vento, I just love her. She's going to talk more about using your voice and what it matters and what's happening in D.C. But I want you to know that right now, the Toxic Substances Control Act is being discussed. They're working on reform. And if the reform doesn't include and name asbestos and ensure the EPA can expeditiously ban asbestos, that is not reform. And we look forward to, thank you, Celeste. So Doug and I have spent over a decade on the Hill. So when you have questions, we want to have those discussions with you this weekend. And how can this be? How can this be human cost of inaction? We've had 17 bills, Fair Act, FACT Act, go figure, and 7 ban asbestos resolutions over the last, it's 1997 to 2015. Where are we today with a ban asbestos bill? Nowhere. So I want you to look at where Congress spends its time, and Sue is going to speak more about that. But this is a very telling sign. And I'm sad to tell you that for the most times, it's seen as a partisan issue. The Republicans want a FACT Act and Fair Act, and the Democrats want a ban. And that can't be. There cannot be politics in public health. The FACT Act we'll discuss more. It invades privacy, delays compensation, denies justice. Yes, this is all part of the human cost of inaction. And what can you do? Everything. We have a new petition site, and some of our partners are in here today. EWG, I don't know if Heather's here yet, but we've launched a petition site with 4 other organizations, including ADAO, and it's going to be not only a petition to your members of Congress, but it's ultimately going to be used to have discussions with the President of the United States, to encourage him to use his pen to veto any bill that does not meet the public health standards of workers, officials, environmentalists, to indeed take care of these problems. And I want you to think about this. I've used this in congressional testimony. Without responsibility, accountability, and transparency, no one is safe. No one is safe. So with that, when you have questions, what can you do? There's going to be a resolution. Actually, in your program, you will see a declaration. We're going to ask all of you, we're going to call on votes, like they did at the Helsinki conference, the yays and the nays. You can look at the language here, so you're very well versed, but we're going to be calling for a vote later today, and with that vote, we will add your signature to this, and we're going to share it with Mezab and other countries so that they can have the strength of everyone sitting here, because all of your voices matter. And that's the human cost of inaction. For one life lost to an asbestos-caused disease, that's tragic. Hundreds of thousands of lives lost is unconscionable. Thank you.